Good morning, everyone. Okay, so we're going to cover feline infectious diseases, and those are going to include panleukopenia, leukemia, feline immunodeficiency virus and/or FIV, feline infectious peritonitis, FIP, upper respiratory infections, and also toxoplasmosis. So the first one we'll talk about is feline panleukopenia, also known as feline distemper, also known as feline parvo, also known as feline infectious enteritis. So we talk about the description of this. Well, panleukopenia is a highly contagious and possibly fatal disease. It's caused by DNA non-envelope virus in the Parvoviridae family. So it goes in that correlation with the canine parvovirus, and this is kind of correlated with that. It is closely related, again, to the parvovirus, although it does not cause clinical signs like it does in canines. Some studies show, however, that the canine parvovirus have been isolated in cats with clinical signs of panleuk and healthy cats. So this is basically saying if you have a parvo-positive dog, you don't want to put an immunocompromised and/or a kitten in with that for the risk of possible transference. Not saying that these are species specific, but the transfer in some studies has been shown. So it's very resistant in the environment and can survive a year longer than the canine parvovirus. So can you think about how long we talked about the canine parvovirus can survive? Okay, add a year to that. Bleach can kill the virus on the hard surfaces. The incubation is about 3 to 4 days post that actual exposure. And then the transmission, it's kind of similar with the parvovirus. The virus particles are shed in secretions, especially the feces. And if you know anything about these clinical signs that's possibly taking place, diarrhea is definitely happening and can get in all small little orifices of the nooks and crannies of a kennel and stuff. So cleaning it is very important to be thorough. It can become infected oral nasally through direct exposure to the infected cats through their secretions of fomites. So think about what are fomites? Well, those are inanimate objects. Here's a hair tie. Inanimate objects like toys, water bowls, blankets, things like that. And they can become infected in utero. So the virus will attack the cells of the cerebellum and also the eye. They will destroy rapidly dividing cells within the bone marrow, the lymphoid tissue, and especially the intestinal epithelium. Clinical signs, we have two different types. So we have vertical exposure. This is when queens infected early in gestation are likely to experience mummification or reabsorption of the fetus. This can lead to abortions and possibly stillborn deaths. Exposure in later gestation will result in cerebellar hypoplasia, or CHP, and the optic nerve will be damaged. This can be a lifelong condition where cats will experience ataxia, tremors, they'll be possibly blind, and they'll have just like a wide-based stance where they're trying to get their... One of the cats that I saw most recently just kind of constantly had ataxia and was unable to, when standing or sitting sternal, was unable to get their balance properly. So then we have horizontal exposure. This is acute fever, anorexia, lethargy, vomiting, diarrhea, weight loss, and also possible abdominal pain. Dehydration can lead to electrolyte imbalance that can cause acid-base abnormalities that could be possibly fatal. So think back to what your electrolytes do and think back to what your kidneys do and how they help keep everything in that homeostasis with our electrolyte balance. If our electrolytes get off, then basically our blood system's not able to perfuse properly and we could become acidic and be off balance, and that would really infect us or hinder us internally. So intestinal crypt cells, if you can think back to the crypt cells, which here's a picture over here, they will damage And in the result of the diarrhea and the malabsorption is the risk of the bacteria translocation. So those cells can become so broken down. They're almost, think of them as like the lining is sloughing off. That's where we can think about the feline infectious enteritis. Those cells just basically are damaged, and it's hard for them to get restored. So know the difference between vertical and horizontal clinical signs. To diagnose this, we definitely have to get a thorough history. We need to know, are we vaccinated? When did you get the cat? Those sorts of things. Physical exam and also clinical signs can be pretty on point. High-risk animals include unvaccinated kittens, feral cats, outdoor cats. There's no in-house test available specifically for this disease. There is a possible cross-reaction with the ELISA antigen test for the canine parvovirus. Some people, I've heard a lot of opinions. Some people say that it's, even if you get it positive, that doesn't necessarily mean that the cat has Pan-Luc, but I've heard a lot of people in the research and study say that it tests specifically for that antigen. So think back to those antibodies and antigens and how the SNAP test works, and that it actually, if it does come back positive, treat it as it would be positive because it's testing for that specific antigen. So a positive test is considered a differential diagnosis, that DDX, for panleukopenia. A negative does not necessarily mean that the cat is negative. The cat sheds smaller amounts of the virus than dogs do, and more infrequently. The best test to do this, honestly, is to send out a fecal through IDEXX or Antec, but you have to get that feces first. Diagnosis further, we can do some blood work. So we can look at a CBC, a chemistry, we can look at our electrolytes, and that will help support that differential diagnosis of figuring out, is this really what we think it is? Reference laboratories offer other tests. We can do polymerase chain reaction tests. You'll learn about those in Lab Techniques 2 with Lindsay and I. We can also do fluorescent antibody and antibody titers to find that specific one. This is an example, and again, we'll do more in Lab Techniques 2, but this is an example of PCR amplification. They're just it's a pretty picture. Just get this word association of what a PCR and think about, okay, if I was asked the question, a PCR or an IFA can be tested for what diseases? You would put maybe C, panleukopenia. Okay, so just get that word association down. Here is just kind of a graph that talks about the blood cell changes that we may see. So our PCV and our total protein, packed cell volume total protein, is going to be increased due to the hemoconcentration. So this is a point where we can correlate Lab Techniques 2, Lab Techniques 1, Lab Techniques 2, and even Lab Techniques 3, and think about and relate it to the diseases that you've already learned about and that you'll learn about in this class. Diseases 1 covered that breakdown, that pathophysiology. A&P, you've got all the whys and the hows and the wheres. And so now we're thinking about the disease process that can happen, and now we're just putting more pieces of the puzzle together. So this is exciting stuff. So the chemistry is going to have hypoglycemia. So we're going to have low blood sugar due to the anorexia and the vomiting. So you definitely want to get a blood glucose on this cat if it's coming in. Electrolytes are going to be imbalanced due to the hydration status as well as the anorexia. And the urine changes that we may see is an increase in urine specific gravity, again due to the dehydration. So treatment, how can we treat this disease? Well, we need to restore the fluids and the electrolyte balance. How do we do that? Place an IV catheter, start IV fluids. Prevent any secondary infections that may be on board. So we may want to get some antibiotics after we've done the blood work. And we want to control the nausea, because if we're not eating, hypersalivating, even if we're not vomiting, that's still signs of nausea. And think about, again, those crypt cells on our intestines that are just kind of broken down, and they're if our crypt cells and that microvilli are not intact, then we're not going to properly absorb any of that nutrients. So we need to get that, we need to calm the stomach, get that restored, and how we can do that is by several medications, which we'll learn about in pharmacology. And we'll just touch base a little bit here. We want to also prevent any bacterial translocation, again, with and that intestinal lining. Fluids, we have to be aggressive and get these on board. Time is of the essence with these guys because it can be very fast. Because think about, it's usually those immunocompromised small little kittens that don't really have a whole lot of weight on them and are very susceptible to these things. Dextrose if we're hypoglycemic, so we can do something like a CRI, which you've learned about those in pharmacology, so a constant rate infusion. We can add dextrose to our IV bag and make that CRI. The big key with dextrose is you have to ensure that that IV catheter is in and is patent, because in the event that dextrose is given sub-Q or peravascularly, okay, so around the vein, if it's blown or anything like that, it will cause tissue necrosis of the skin. So we really want to make sure that you're checking that IV catheter constantly if this animal's hospitalized. My dog, sorry. We also want to get some anti-vomiting medications, antibiotics on board. We need to be in isolation and possibly a blood or plasma transfusion to restore deficient blood cells or plasma proteins that may be going on. So in these pictures, we've got some dextrose up top. We've got a blood bag, and down here, they're giving a blood transfusion. Okay, and we'll learn about blood transfusion medicine in either the latter part of Lab Techniques 2 or first thing, Lab Techniques 3. Nutrition is so important. I'm slightly partial. But nutritional support is imperative. So syringe or force feeding can be the first steps, and we'll see how receptive the animal actually is, because sometimes you can put food in there and it just comes right back out. We could also do a nasogastric tube or a gastroesophageal tube. The most common ones, and I'm sorry my face is in the middle of this, but you can pull up the PowerPoint separately. Here is an NE tube, or I'm sorry, esophageal tube, not a NE tube, esophageal tube, where it literally has gone into the esophagus. We make a puncture into the esophagus, pass the tube down through, and then that will get into the esophagus and trickle down. This is a nasal esophageal tube up here and or nasal gastric tube where it's fed through the nose and gets into the esophagus and or the stomach. We'll learn about more of those in nutrition. The sooner the feeding, the sooner the recovery, because what that's going to do is it's going to kick our body into metabolism. That's going to cause our MMC, our migrating motor complex, which is in our GI system, to then sweep through and kind of restore all those cells. Exclusive enteral feeding within the first 12 hours of hospitalization will improve the survival rates as compared to a traditional NPO treatment. So like I said with canine parvovirus, this is as well. It's kind of the old studies showed that NPO, if they're vomiting, having nausea, let's just not feed them at all. When actually through research and further study, it's been proven that it's better for us to get food and to help that healing process. So try to feed as best. Side note, if you have a patient that is not interested in eating, what are some ideas or ways to encourage this eating? Okay, well, you could warm the food up, get something stanky, Friskies, Fancy Feast, just kind of some garbage. Positivity, okay, between treatments. And when I mean positivity, I don't mean like running into the kennel and scaring the cat. Just try to pet the cat, feel its body language. What extra mile can you do? Can you go beyond the treatments? Go beyond the whiteboard. That's just the things that are being asked of you between the treatments, and make it a positive thing. Okay, make the food a positive thing. If the animal vomits, and then you try to offer it food, it's going to get an association of, I don't really want that. Or if you, and they'll associate those smells. Also, if you say, draw some blood, okay, and then you try to offer food immediately after, they might associate that with, okay, well, if I eat this, maybe I'll get blood drawn or something. Just think about that, okay? Those may be things that are being taken place. Some are social eaters. I have known several cats in the ICU that once I start itching their little booty area, that tail goes up and they're like, okay, I'll start eating now. So you may just have to hang out and have some lunch or dinner. Just hang out with them. Know if they like dry or canned. This is something that we can ask owners, or you can just try to offer several ones. Toppings, ketchup's a really good one. Nutri-Cal. Try to entice them a little bit. And change it frequently. No cat is going to eat food that's been sitting out for over 30 minutes. They may if they're desperate, but no hospitalized sick animal is usually going to go for some stale food. And think about the oxidation and free radical process that's taking place too. So we want to change that out pretty frequently. Not all at once. Space out your options. We don't need a buffet at the Golden Corral, just kind of in between every hour or so that you're going back into that isolation area. If they're not interested in one, try a different option. Treats, kind of yay or nay. Just kind of watch if we're trying to get to eat anything, that would be great, but watch the carbohydrate level. Our vaccinations are really important. That is that client education and technician tip that I can't stress enough. Not feeding outside while in an early developmental stage, especially in warm months, controlling the flies, because flies can be those vectors. How are they those vectors? They land on poo and they fly around and land on you, like the cat. Avoid exposure to unvaccinated cats. It's not as common as it once was, but is seen in outbreaks, rescues, and unfortunately. Cats can shed the virus for up to 6 weeks post-recovery. Okay, that's definitely something we want to express to clients. And it can infect other cats during this time. So that 6 weeks, do know that. Cats will not reinfect themselves, so that's cool. Owners should wait at least 1 year before bringing a new unvaccinated kitten into the household. Okay, because remember, just like the parvovirus, it can stay in the environment for a long time, but add a year on top of that. That CHP kittens can have a good quality of life with owners that understand and they're willing to meet those needs. Remember those kittens that are kind of wobbling around that were at that exposure in utero. Okay, so now we will talk about feline leukemia virus. The description, it's caused by enveloped RNA virus from the Retroviridae family, is often labeled as the Oncorna virus, the onco for tumor, plus that RNA that's involved. Major causes of mortality in cats to the severe immunosuppression that takes place for these guys, as well as the anemia and the neoplasia that can happen. Domestic and wild cats throughout the world can have this disease, and it's been shown with that, and that relates to that mortality rate. It's liable in the environment. It only survives for several hours. So comparatively to panleukopenia, this virus is definitely not going to last as long. The incubation period is between 2 and 6 weeks. Acute signs of the disease are detected at those times. Transmission, we have that horizontal transmission. So again, think back to that horizontal and vertical transmission that we talked about with panleukopenia. In contact with the secretions, again, that's how it can be transmitted, that horizontal transmission. Saliva is where most of the virus is shed. So urine, feces, and even tears can shed the virus. Fighting, grooming, the exposure to fomites are all possible transmission methods. Then there's the vertical transmission that is in utero or shortly after birth during nursing or grooming. Most cats acquire the infection as a kitten. Kittens are higher risk due to their immature immune system. The oral nasal route allows the virus into the body, where the virus will spread through that lymphoid tissue that's present, and then once it's through the lymphoid tissue, it then will enter the bloodstream. Once infected, there are several possible outcomes. Cats that have a significant immune response will have a transient viremia, and that's going to be that primary infection that's going to be taking place. These cats will clear the infection in their body within about 16 weeks. If the virus spreads to the bone marrow, it is said to be persistent and have a secondary infection. So know the difference between that primary infection and secondary infection that can take place. The bone marrow is often referred to as the point of no return. The immune system is not able to suppress the virus, and most cats will be infected for life. So this is saying that we may actually have a primary infection, and the body may be able to take care of it as long as it's not within the bone marrow. Clinical signs, we can have acute clinical signs where we have fever, lethargy, lymphadenopathy, and blood cell deficiencies. We can also have persistent infection where we'll have anemia and our immune system is going to be really suppressed, and we can also have that enteritis taking place. Okay, where was I? So we talked about possible neuropathies taking place. So we talked about anisocoria. Well, as this picture shows, that's not a great color. Right here we can see that the left eye, the pupil size is much larger than the right pupil. Okay, and that's what anisocoria is, and that can happen one of two ways. The one we're particularly talking about is a neurological issue. There can also be blood pressure related causes that can lead to anisocoria, which we'll talk about when we get to ocular disorders. There can be blindness, hind limb paralysis, ataxia, seizures, and possible urinary incontinence can take place. Immunosuppression predisposes the cat to concurrent and secondary infections. Why? Because we're immunosuppressed, so we can possibly get other secondary taking place. To diagnose this, we do an in-house FELV with ELISA test kit that's going to detect that viral antigen. It's quick, it's easy, and it's relatively inexpensive to get that full differential diagnosis. And this is something that either the test takes 8 minutes or 10 minutes and that you can do in-house. The test will detect the virus but cannot differentiate between an acute or persistent infection. So again, remember those two different types, that acute infection or that persistent one. If a cat tests positive using one of these test kits, it is recommended to then retest in 3 to 4 months to see if the virus has been cleared from the body. For example, my dear friend Jackie, she found a kitten driving home one day, and she brought it in, we tested it to see how it was, and it did test positive for FELV. We then, in about 5 months later, tested it again, and it was negative. So that was one of those acute infections. If the virus has made its way to the bone marrow, again, that immunofluorescent assay test can be done in that reference laboratory. So what are we going to see on our blood work changes? Well, we're going to see a PCV and a total protein. It's going to be decreased due to the anemia. It's going to be hemoconcentrated due to the vomiting and the diarrhea. Our chemistry panel is going to reveal a low blood glucose due to that wasting away, vomiting, diarrhea, inappetence taking place. Our electrolytes are going to be imbalanced due to the dehydration as well as the anorexia. And urinary changes, we can see constant UTIs because they can be systemic at that point. There, unfortunately, is no cure for FELV, especially when most cases are diagnosed at the point of the persistent infection and not the acute. Chemotherapy and antiviral therapies are being tested, but there's no cure for this. So treatment, how are we going to treat these kiddos? Disease management includes keeping the cat stress-free, because what can stress do? Stress can suppress our immune system and kind of get us all out of whack, as some of you may have known through being in college. We want to keep them indoors because we don't want that transference to happen even more. Isolate from infections. This can be found with raw meats, so we don't want feeding a cat a raw diet that is immunosuppressed is a risk. It's not the wrong thing. It just can be kind of risky in that they may be more susceptible to possible infections and bacteria that may be present in that raw meat. Spaying and neutering is definitely going to help because it's going to lower those desires and needs, okay? And especially because that's one way of the transference. Vaccinating schedule, it has to be on point. If any secondary infections arise, the treatment will no longer or will be longer and stronger than if we were negative. We recommend physical exams, blood work twice yearly. That may be hard for some people. Client education and technician tips. So what can we tell clients? Well, methods for prevention of the disease transmission. Routine disinfection of the areas. So you want to make sure that your isolation area or exam rooms, and express that to the owner as well. Make sure that they clean up after themselves or their cat. Frequent hand washing. Avoid multi-dose vials. So we don't. That would be if you're vaccinating an animal and you're using that same rabies vial, same other type of medication vial. So we want to change those needles out, especially. Testing all blood donors to make sure that they're not present for any viral diseases. So if you need to do a blood transfusion for these guys, you want to make sure that everybody that then is donating is healthy. Eliminate fomites and dispose of those clinic items that they would. Isolation of positive cats. Eliminate the spread, okay? You need to get in there with your gloves, with your gown, with your booties, have your bleach baths. I'm going to do a video of a ideal isolation area at my work sometime soon. I'm not going to go into isolation if I don't have to. So the isolation area, as you've probably known from your other classes, is anything can go in, but nothing's going to come out besides, hopefully, that patient that's now doing better. Protect their fragile immune systems, okay, and that's why we're isolating them from any other possible secondary infections. So it's not necessarily what they can get in there, but what can you give them. So making sure that you're clean and you're wearing your proper PPE is important for them as well. They should not be kept in the isolation wards for fear of infecting them with the disease from that ward as well. Vaccines. So considered to be a non-core vaccine by the AAFP. Vaccination of high-risk cats should be done. This is especially with our outdoor cats or our feral cats. So that's a big question you need to ask clients is, do they go outside? No, they don't. Well, are you planning to take them outside? Do you have like a bunch of cats in the house? Those are questions we need to ask when gathering our history. Negative cats living in the house hold with positive cats. That can happen, and you just have to be careful and vaccinate those cats that are negative, so that way if there's any possible transference, they could be protected. Talk about vaccine risk with the owner prior to giving. Sarcoma development. So I know you've talked about this probably in Diseases 1 as well as office practices when you went over vaccines. A sarcoma can develop. It is low possibility, but that is especially important on where we vaccinate. So can you think about where we would vaccinate cats and where is the ideal place? A positive test does not mean euthanasia. Okay, you have got to make sure that you've got owners that will be aware of these things, take good care, especially if there's other cats in the household. A positive test that cat may fight off the disease. Even if the infection is persistent, these cats can be managed and have a good quality of life for several years. We do have to watch the secondary infection. So other cats may develop a viral infection. What's a number one viral infection that can happen with a cat that is immunosuppressed? We get an upper respiratory infection. That's probably that number one thing. There's no evidence of zoonosis, but immune-compromised individuals, as in people, are not recommended to own a positive cat due to the possibility of zoonotic secondary infections. Again, it's not a proven thing, but if you just think about it, that immunodeficiency person could be susceptible to a possible secondary infection, not necessarily that they would get feline leukemia.
Okay, so now we're going to talk about FIV, or feline immunodeficiency virus, and or feline AIDS. Note, this is not if a cat is positive for feline AIDS, this is not a death sentence because they're still positively adorable and adoptable. So the description of FIV is it is the leading cause of death in cats worldwide. It's also very closely related to FELV. It is a non-enveloped RNA lentivirus as well as a retroviridae family type of virus. It causes bone marrow suppression as well as immunodeficiency. So unlike FELV, FIV is a disease where they're going to have lifelong. With FELV, there was 2 different forms, and sometimes they could grow out of it. But with FIV, that's not the case. They're going to have it lifelong. It's seen in domestic cats as well as wild ones. The incubation period is about a month or even years, and has a long patent phase. It's not really viable in the environment, and it only is going to last about a couple hours within the environment. So in retrospect, that is good, and unlike RPM leukopenia that can live for a year and longer. Note too that for testing wise and such with FIV, it takes about 6 months for that to be detectable. So again, that's a long incubation period. How this is transmitted is most commonly through saliva, bites, wounds as well. Once it enters the cat, it reproduces in the T lymphocytes and spreads to the other white blood cells, then to the lymph nodes, to salivary glands, and then eventually it will wind up in the central nervous system. It can be spread from mother to kitten through that transmission, but it's rare, but it can happen. And it can happen within the birth canal or nursing from the infected queen's milk. Other possible transmission routes, there is the blood this can be transmitted from a blood transfusion, so if a clinic does not properly type their cat or donor, you're unaware, or if you have a cat that goes outside and you don't do proper testing to make sure that it doesn't have any infectious diseases, it can be from a blood transfusion. Also, sexual contact, both are rare, so it's rare that we at a clinic would not properly test their donor or the blood transfusion, blood being present. And then also sexual contact is rare. Fomite transmission, it's unlikely in cats with casual contact and they have little risk. But again, infection cats will be positive for life. Infected cats will be positive for life. This makes them a reservoir for the virus. So older males are more susceptible, feral cats and also free roaming cats. So think about that. If you have a positive cat for FIV, they are going to be that reservoir. They're going to harbor that disease, that virus, so it's easily to be spread to other. So ideally, you would want to have a cat if you have a client that has a cat. You want to make sure that they're keeping it indoors and healthy. So there's 3 stages or phases of this disease. There's one, the acute stage, and that occurs within 4 to 6 weeks of post-exposure. It often goes unnoticed, and they're non-symptomatic sometimes, and it goes unnoticed. But signs that we can have is lymphadenopathy, bacterial infections from like the skin or the GI. We can have pyrexia, we can have lymphopenia, and also neutropenia as well. During this stage, the virus is spread through the T lymphocytes and then eventually through the lymph nodes. So remember we talked about it gets in the lymph nodes, bloodstream, so on and so forth, bone marrow. Know those stages. Then we have the latent stage. This is most cats will recover from the initial acute signs and will appear healthier. Persistent lymphadenopathy is also possible, and this stage will last for months to possibly even years. Then we have the final 3rd stage, which is the chronic stage, which kind of goes with the name association with it. It's associated with severe immunosuppression. It results in secondary infections. So they have this FIV, but they also have another condition that's taking place. So they have infections within their respiratory tract, their urinary tract, their gastrointestinal tract, and also their skin. Clinical signs include gingivitis, as shown in this picture, as well as the stomatitis. We'll also see diarrhea, wasting, waxing and waning, and anemia as well. So this cat's mouth looks very severe. It has severe erythema. Think about this too. They're not going to be eating, so they're going to have anorexia as well because it's going to be really, really painful for them to eat. Other clinical signs, we have encephalopathy, of course. We talked about that it'll enter in the central nervous system, so encephalopathy can take place, and seen especially in kittens. So you may see the kittens may display seizuring, circling, pacing, then also aggression. That aggression may come from the inability to properly ambulate or think, really. So that be careful with that, especially because these are outdoor cats that may be free roaming and feral. FIV may also cause ocular dysfunction. You may have interior uveitis. They can develop retinal hemorrhaging or deterioration of the retina, and they can also develop glaucoma. So to diagnose this virus, we look at the physical exam, of course, we look at the clinical signs and the history. We need to get all those things. Are they vaccinated? What are some of the clinical signs? Do they live outdoors? How are they exposed? An advanced stage of the disease, hematology and serology workup can help, but it's not definitive. Luckily, we have an in-house ELISA SNAP test that can help us with this, and it's usually in combination with the FELV test and a heartworm test too. However, the shortfall of this test is testing for antibodies. So false positives are possible in kittens born to infected queens and vaccinated cats. Positive kittens should be retested for maternal antibodies. The MAs are no longer circulating. So with this one, the test is specifically looking for the antibodies that would be present. So unlike the antigen. So the false positives can happen. And especially if it's a smaller kitten where you don't know the age and the people just found it in the road or something, you would want to retest that in probably 4 to 6 months. You can do an IFA or a PCR and also a Western blot. We'll talk about those a little bit more in lab techniques too. Antibodies can take up to 12 weeks after the initial infection to form, and therefore negative cats should be retested up to 60 days after the negative test result. Cats with a very advanced form of this disease may test negative for lacking those antibody formations. So unlike we talked about with the parvo test, which is a definitive diagnosis for the test, this one you may have some variance within there. And usually it will come up positive. Treatment, there is no cure for FIV. Treatment is aimed at protecting the immune system and keeping the cat stress-free, because what can stress cause? That can suppress our immune system and cause secondary infections. Keeping them indoors and then making sure that they have optimal nutrition available. Spay or neuter with proper vaccine schedule. This is very important because of the way it's transmitted. Monitor for secondary infections such as pneumonia, upper respiratory infections, especially in cats, are more susceptible. Physical exam and blood work need to be done twice yearly. You're good to get people in once a year, but twice yearly would be great. Little evidence shows that antiviral drugs work on fighting this disease because it's a virus. It's really hard to interfere with those. Severe cases of recurrent stomatitis, they may require a full mouth extraction. So that stomatitis, that picture that we showed, if that just gets even more severe and it never clears up, you may want to do a full mouth extraction. That's not necessarily a terrible thing. Cats can live happy, healthy lives on that as long as you have owners to make the changes that's needed. The best prevention, honestly, is to keep your cat indoors. Ensure that new additions to the household, so if an owner gets another cat, that they test it prior bringing it into the house, and make sure that your vaccination schedule is on point. There is a non-core vaccine available for FIV, but it is rarely used because it just destroys the usefulness of the testing. So if we give the vaccine, if we ran a test, it's going to interfere with that. Okay. So now we're going to move on to feline infectious peritonitis. So the description of feline infectious peritonitis, it's caused by a virus in the coronavirus family, and it is highly fatal. Okay, so this is often known as FIP. It's worldwide. FIP is seen more predominantly in domestic cats and less in wild cats. Many cats may be infected with the coronavirus and they will develop FIP. So we don't necessarily, A lot of places don't necessarily vaccinate for the coronavirus anymore, but keep in mind that FIP, feline infectious peritonitis, is in the class of the coronavirus. So they may develop the coronavirus, but it may also show FIP as well. The disease is thought to occur due to the mutation from an enteric coronavirus or an abnormal immune response in a cat. The virulence will vary among strains of this disease. Survivability of this virus in the environment is about 4 to 6 weeks, although this enveloped virus is easily killed by normal disinfectant means. So that's at least a positive. The transmission of this disease is by ingestion or inhalation of the virus. It's shed in the feces as well as the saliva, and is spread from cat to cat or by the fomat. See, there's the fomat. Look at that fomat. Okay, it's cute fomat. The virus starts replication in the intestinal epithelium. So think of those tissues within the intestinal wall, and then it's transported through the white blood cells and it's going to multiply within the body system. With our transmission, the organs that are going to be infected include the liver, the spleen, the kidney, the brain, as well as the lymph nodes. And that makes sense because this is all in circulation. An extreme inflammatory process occurs within the blood vessels itself. So cats of all ages are at risk for this. It is seen in cats less than 2 years of age, more so. It is more common in purebred cats because they're from catcheries. And some breeds are going to be more susceptible, like a Bengal or a Himalayan. So the acute form of this disease are going to show asymptomatic signs, but we also may have mild signs such as pyrexia, respiratory disease, diarrhea, and very few will develop the clinical FIP weeks to years after the exposure. The cat's immune system plays a role in the development of this disease as well as its clinical. Every cat is different. So there are 2 forms of FIP. There's the effusive or wet form, and there's the non-effusive or dry form. Okay, it can have both forms, not bothered forms. It can have both forms. The effusive form develops more rapidly. Severe vasculitis causes leakage of plasma and plasma proteins into the body's cavity. So if you look at this picture of this cat, okay, it looks like a pear. Let me draw it for you. Pear, okay? This pear shape down here at the bottom, what this is that excess of those plasma protein. So it's leaking. The vasculature is leaking those plasma proteins into the abdominal cavity. And fluid's going to collect in that abdominal space and as well as that pleural cavity. And it can be collected using a sterile syringe and needle and doing like an abdominal centesis, and that can be a visual indicator to prove that it is FIP. So that can be a differential diagnosis and a definitive diagnosis if your doctor were to do an abdominal centesis and pull fluid out of there. Because it's plasma proteins, it looks kind of straw, yellowish colored. So that distended abdomen is going to be a good indicator as well. Because our abdomen is going to be distended, because our vasculature is going to be leaking, they may also be dyspneic due to that ascites. Okay, so due to that swelling, due to all that there, they may be dyspneic and having trouble breathing. Technically. The non-effusive form is more chronic with non-specific clinical signs. They can have pyrexia, lethargy, anorexia, weight loss, ocular and possible central nervous system issues. And this can include anterior uveitis, which is inflammation of the middle layer of the eye. They can have retinal hemorrhaging, which is bleeding of the retina, and blindness as well as seizures. With this form, you may see only ocular and central nervous system signs. So I do need you to know there's 2 different forms, the wet and the dry, and know the differences between those. Pyogranulomatous lesions may develop in the abdomen because the immune system attempts to wall off the virus. Your body's really going to try to fight it off, but it just can't. The masses can obstruct the GI function and cause there to be gastric stasis as well as other gastric issues. Adhesions between the liver and the diaphragm may also develop, as well as the intestinal bowel loops and overall the other intestinal organs may develop too. Nodules on internal organs or areas of focal necrosis may be seen. So, long story short, this kind of just interferes entirely with the GI abdominal cavity internally. To diagnose this, well, there's no reliable definitive test for FIP. It cannot differentiate between the enteric coronavirus and FIP antigen or the antibodies that would then be formed. So a positive antibody titer running a PCR does not mean that the cat is clinical for FIP. Okay, so clinical signs, how are we gonna diagnose? Well, we're gonna get those clinical signs. We're gonna get that physical exam, the history, and roll out other differential diagnoses as well. The picture of the cat that looks like a pear probably gets that. So again, we're going to look at that fluid analysis. If that abdominal cavity is distended in any way, we're also going to grab maybe the ultrasound. If your clinic has an ultrasound, stick the ultrasound probe on the abdomen, and if there is a visual of fluid, if the patient is stable enough and if you have the equipment to, do an abdominal centesis or a thoracocentesis if it's in that pleural space, and look at it. Again, I talked about that fluid analysis. To reiterate, it will be viscous straw to yellow colored. It's an exudate that is white and gray in color. It will have an increased specific gravity and protein level and be mixed with inflammatory cells. And again, it's going to have that mixed protein level because it's the plasma proteins are leaking from the vasculature. This is not a picture of FIP. One, because this is a dog. But two, because this is blood, they're doing abdominal centesis for some other reason. I'm just wanted to show you a picture of an abdominal centesis being taking place. So what can we find on our lab work? Well, it's not definitive, but it will help in developing your diagnosis and for also your treatment. This is going to be more so with the dry form, the non-exudative form, effusive form. Exploratory surgery or necropsy will let you know of the pyogrammulomatous lesions that would be present within the abdominal cavity and on those organs. But our blood work is going to show leukocytosis, especially in the neutrophils. Our PCV is going to be decreased due to the anemia. Our total protein is going to be increased due to the proteins in the body trying to do more than it should. On our chemical analysis, our liver, kidney, and pancreas will show dysfunction. Overall, those levels will probably be elevated. In fluid analysis, we can again see collect it sterilely. It'll be viscous, so it's going to be sticky. It's going to be kind of tacky because proteins are tacky. A straw to yellow color, increase specific gravity as well as total protein, and those mixed inflammatory cells. Treatment, there is no cure, and it is highly fatal disease. The effusive form progresses more quickly, and again, it is seen very rapidly, more than the non-effusive form. Most cats fatal within weeks to even possibly months after the onset of those clinical signs. The non-effusive, it's more insidious, and it progresses more slowly over months to even possibly years. So how can we treat this if they have the non-effusive or dry form? We can do anti-inflammatory medications. We can also do antibiotics. This here is called Clavamox. We'll learn about that in pharmacology, but this Clavamox is technically amoxicillin trihydrate clavonate potassium. Medication, it's Clavamox. You can call it Clavamox. It's an antibiotic that can be used, and this would be oral. You have to reconstitute it. We can also do immunosuppressive therapy. This combo will make the cat more comfortable and possibly extend the lifestyle a little bit. Fluid can be drained from the abdomen or thorax. This is only going to be a temporary thing, okay, because it will accumulate. That fluid will accumulate again. Optimal nutrition is especially important. We can also do a blood transfusion. Hi, buddy. Thank you. There you go. Okay. There is a blood bag. This is, just a side note, this is type A. So we'll talk about the different types of blood that animals have and cats have A, B, and AB. Okay, and we'll talk about the differences later. We also do fluid therapy, IV fluid, sub-Q fluid as needed. Euthanasia, unfortunately, should be considered due to the virulence of the disease and also the state of the patient, as well as an economic standpoint for them. So, client education. Prevention by vaccinating for FIP is rarely used due to its lack of effectiveness, but there is a vaccine for FIP, but it's not commonly used. The vaccine may be used in high-risk situations, such as cats that are in catteries, shelters, or even the possibility of being exposed outdoors. Isolation and sanitation, once again, are very important factors. So, now we're going to talk about feline upper respiratory tract infections. These are really funny pictures. This is probably one of the most common things that we see with cats, especially young kittens, that because their immune system hasn't fully developed, and so this is their big allergy organ. So for people, think about with people, our big allergy organ is our respiratory system as well. And so usually for animals, their big allergy organ is skin conditions, but a lot of times for cats, they have their own, and it's usually an upper respiratory infection. Okay. So those two different major causes, one can be from the feline viral rhinotracheatis. Next one can be from the calicivirus. There can also be possible bacterial causes, but those are going to be your two main types. Survivability in the environment varies with the agent, but most are typically fragile, and they're only going to last about 2 or 3 days, a few days at maximum. Incubation period is usually between 2 and 10 days. Transmission is mainly spread through fomites. How is this different from canine respiratory infections? Can you think about it? Well, dogs and aerosolization. Although aerosolization or respiratory secretions is implicated in the spread of this disease, direct contact, cat to cat, is also a factor because they love on each other, they nose on each other, they're purring on each other. And they're carriers of the respiratory disease for possibly even years after recovery, and they act as reservoirs for this infection. It's common in shelters, catteries, and also multiple cats. It's definitely probably seen in clients that get a new kitten, they bring it home, it develops an upper respiratory infection, and then your cat may also develop one as well. Clinical signs, we see nasal discharge, congestion, sneezing, lethargy, fever, ocular discharge, ocular ulcerations, and even conjunctivitis. We do want to make sure that if there is ocular issues, and if they're kind of squinting more so than just kind of discharge being present, we would want to do a corneal stain to make sure in the process of being like, hey, my eye itches, they didn't accidentally cause an ulceration or a scratch there. But you'll definitely see conjunctivitis, which is inflammation of the conjunctiva. We'll also see anorexia because they just feel bad. And cats cannot smell their food, which they usually like to eat. They want to smell it before they eat it. And also it can cause oral ulcerations too. And that's going to be painful, and that's going to lead them to not want to eat. They may also have some open mouth breathing, but they're not necessarily panting like they're in distress. They just are congested and cannot breathe. We can also see hypersalivation from, again, those oral ulcerations too. Severe cases, we may see dyspnea, difficulty breathing, stenosis, their tongue may go blue, and also, again, that open mouth breathing. Now, it can lead to the open mouth breathing where they are having issues like dyspnea, stenosis, and we really need to intervene. So to diagnose this, we're going to look at our clinical signs, physical exam, as well as our history. It is difficult to differentiate between the two causative agents. So is this viral, one of those two virals, or is this bacterial? Okay. You can send out to a reference laboratory to confirm which type, but that's rarely used because we kind of go with our gut and go with the two major viral types. But it can be bacterial, and one of those bacterial things can be chlamydia, and it's suspected in cats that have the ocular involvement. So this is a picture of fluorescein staining. Okay, so we're staining the eye to see if there's any uptake. This is the process. So you grab one of these strips, and one of these strips has, in this yellow, you put a drop of saline, which is what this is dropping into. Put a drop there. You then take this little card piece, and you'll do this, you'll talk about this in CP, and place this onto the eye. Okay, and then that's going to make this, see this green stain uptake here? It's going to then kind of stain the eye. Again, this is fluorescein staining, not straining. And if there's uptake, then that means that that ulceration scratch has took up the stain, and there is a scratch present. And that's really important because we want to give drops to the cat. We want to supply medication, but we need to make sure that it's not a medication that has a steroid in it, because you cannot give medicate an eye with a steroid that has a scratch, because it's not going to let it heal. Okay, so always, always, always do corneal stains before putting any sort of drop in there. For treatment, prognosis good, except more difficult for neonates and also geriatric felines. Oxygen therapy may be required in severe cases. Supportive care, including fluids to correct the dehydration, as well as antibiotics to treat or prevent any infections. Cleaning the discharge from the eyes and the nasal passages are very important to help your kitten out or cat out. Relieving the congestion, especially. Eye ointments can be applied if needed. Optimal nutrition. Patients, especially that are having anorexia, we want to give them options and high caloric foods. So force feeding or tube placement may be needed if you've got a very severe case. There is an amino acid supplement called lysine. This is just one of the brands, and they call it Viralice, but the biggest thing here is it's an amino acid supplement, and it has L-lysine in it. It's popular to have and to help especially suppress those clinical signs, as well as the herpes virus infections. Something good for owners to take if you have a cat that's not super severe, it doesn't need to be hospitalized, you can treat with symptomatically, but also go see if your clinic can get this Viralice, because that's an amino acid supplement that owners can give at home to help with the healing process. So for education and technician tips, vaccinations are available for this, and it's with the core vaccines. There's good ventilation, sanitation, and isolation of the sick cats. Can't reiterate that enough. We need to eliminate the fomites when possible. The C. felis infections can be zoonotic, so it can cause conjunctivitis, so that chlamydia can be zoonotic for humans. So just practice personal hygiene. Just tell clients to wash their hands after touching the kitten. Also, if you have multiple kittens in a household, try to wash your hands and isolate them as best as possible. If you have a whole litter that then has it, if there's one that's not doing better than the other, if they're all pretty static, then it's okay, but make sure to monitor those, because you may need to isolate them, because one of the kittens may be getting a little bit better, but then kind of be exposed to a little bit more so than another cat. So just make sure that the owners are watching. So the last disease that we'll talk about is toxoplasmosis. So can you think, one, this is just a cute picture. Two, can you think about why we are putting a picture of a baby and a cat? Hopefully your brain has. So it's caused by Toxoplasma gondii. It's a zoonotic protozoa that we see worldwide, and we talked about this in parasitology. Both wild and domestic cats are only the definitive host of this parasite, meaning other species become infected through, but do not shed the parasite in their feces. Cats rarely have clinical signs as a result of this protozoan, yet are important carriers of this disease with the zoonotic risk for humans, especially pregnant women and people with severe immunocompromised systems. It can cause congenital birth defects in babies born from mothers infected during their pregnancy. So if you suspect that you are pregnant, you should go get tested for possible toxoplasmosis, and see if you were once exposed to that, so that you don't have to protect yourself. You know about that. We covered that in parasitology. Also, consumption of tissue cysts in infected meat, dairy products, protozoan, oocysts, and cat feces, and also transplacental transfer from mother to fetus is possible for the transmission. So watch your meat, watch your dairy products, and also don't eat cat poop. In transmission, it's infected through the consumption of uncooked meat, like we said. Bird or rodent tissue with oocysts later, that can be seen 3 to 10 days, and it's released in their feces. These oocysts become infected a couple days after entering the environment, and they survive for several months to even a year within that environment. Some cats, the protozoa will translocate through the intestinal wall, making its way through to other tissue where it will cause tissue cysts and also possible damage. So keep in mind with cats, we're rarely going to see any clinical signs, but if we do have a cat that's immunocompromised or a neonate, we may see clinical signs. We could see enteritis, myocarditis, inflammation of the myocardium, pneumonia, hepatic necroses, so liver issues, lymphadenopathy, as well as encephalitis. Clinical signs, if we do see them, are going to be anorexia, lethargy, fever, diarrhea, dyspnea, cough. They can be icterus, so yellow jaundice because of the liver issues. We could also see seizures that could possibly lead to death. So with clinical signs, in humans, we can see blindness, deafness, respiratory defects, central nervous system disorders. Newborns may be born with these conditions, or they may manifest weeks, months, or even years later. I do not recall why I have a picture of Kevin Hart and Tiffany Haddish, but they are 2 of my favorite comedians, so maybe that's why I put it in there a year ago. To diagnose, since clinical signs are very vague, that's not really a good way to diagnose that. We can do antibody titer test is available through the reference labs in both humans and in veterinary medicine. Pregnant women can have their cats screened for this when they have one on the way. Cats testing positive for antibodies without current infection is not likely at a risk for transmitting that disease. Negative cats should be handled with more caution, and women can also be screened. Positive antibody results without current infection means there has been a past infection, and women are not at risk of transmitting the infection to their fetus. So it's really important if you're pregnant, especially in the veterinary field, and any pregnant woman that has a cat, to make sure to be tested. Your doctor should recommend that. Tissue collected at necropsy of these animals in diagnosing can be used for histopathology. A differential diagnosis is determined with pathological tissue changes consistent with the Toxoplasma gondii. The feces of cats can be evaluated looking for those oocysts, yet this is often unreliable as these look similar to other parasites. I already know. So for treatment in cats, treatment is rarely necessary because again, they can harbor it as a reservoir and usually they're not clinical. But if we need to do that, if they're immunocompromised and or they are a small neonate kitten or geriatric, antibiotics can be administered, antiparasitic drug therapies need to be in place, and humans need to consult with their physician. That's not us. Plant education and tips. Cats only transmit oocysts with their first exposure. Subsequent exposures do not pose a threat, making the cats infective only once in their lifetime and only for a couple of days. They strictly indoor cats are likely to have a little risk of the owner of having the disease, as they're not hunting for prey and in transmission. The feces of cats is the only secretion that is infective. So pregnant women will not get the infection from casual contact with a cat, as it has to be contact with the feces and those oocysts. Pregnant or immune-compromised individuals should avoid cleaning the litter boxes. Make your husband do it or wife do it. And also wear gloves. The litter boxes should be cleaned daily, sanitized with bleach or boiling water, and wash hands immediately. In North America, people are at more risk for infection by eating uncooked meat or drinking or eating unpasteurized dairy products or raw, unwashed vegetables than direct contact from a cat.